Welcome to the deep dive. Okay, so if you're heading towards or maybe recovering from a cesarean section, you probably know, well, just how much information is out there. It can feel overwhelming.
It really can.
And it's like one of the most common surgeries in the world, right?
Yeah.
About 1 in 3 babies arrive this way.
That's right, a huge number.
So our mission today is simple. Cut through the noise. We want to give you a clear, kind of achievable timeline for healing. From those first hospital days right through to feeling strong again long term.
Exactly. And look, we absolutely have to respect that this is major abdominal surgery. There's no getting around that. A recovery, it's definitely achievable if you approach it the right way. So we're thinking about it in 3 main phases. First, that immediate hospital phase, maybe day 1 or 2. Then the early home phase, the first, say, 6 weeks. And then what happens beyond that 6-week point.
Got it. Okay, let's dive into the hospital part first.
Yeah.
Because this is where, honestly, some advice feels a bit strange. You've just had surgery, but they want you moving, like, almost straight away.
Yeah. It does seem counterintuitive, doesn't it?
Totally. Why the rush?
Well, it's really about protection. That early, gentle movement, just getting up, walking to the bathroom. Maybe it's actually key to preventing blood clots.
Oh, okay. That makes sense. Serious risk postpartum.
Very serious. And it also helps circulation, which promotes that internal healing.
Yeah.
Gets things moving.
And that must tie into managing pain, right? Because moving hurts. I know lots of people want to just, tough it out.
Oh, definitely don't do that. Our sources are really clear here. Stay ahead of the pain.
Ahead of it. How?
Using the medication you're prescribed initially, and then keeping up with, say, over-the-counter anti-inflammatories when you get home.
Yeah.
It isn't just about comfort.
Right.
Good pain relief actually lets you move better. It lets you cough without feeling like you'll split in two. And crucially, it helps you care for your baby more easily.
Speaking of the baby, breastfeeding.
Yeah.
If you choose to breastfeed, protecting that incision is vital.
Absolutely key.
So we need to remember those specific positions, like the sideline one.
Yes, sideline is great. Also that sort of upright L-shaped hold, or the football hold under your arm. Anything that keeps the baby's weight and little kicking feet off the actual incision site.
Makes sense for those first few days, but then you go home, the heavy-duty hospital meds wear off.
And the rules change a bit. Now you're in that early home phase, week 1 to 6. And there's really one golden rule here. It's non-negotiable.
Okay, lay on us.
Avoid lifting anything heavier than your baby, period.
Wow. Okay, that's tough. Especially with toddlers around, or even just a heavy car seat, right? Nothing heavy.
Honestly, nothing heavier. That internal tissue, the fascia, it needs proper time to heal and knit back together. Straining it early on, you risk delaying healing or even causing injury.
So heavy laundry baskets are out. Picking up the toddlers out. Bulky groceries.
All out for now. Instead, walking is your go-to exercise. Gently build up. Maybe aim for 30 minutes a day eventually. Great for circulation, great for energy levels too.
Okay, but this brings up something important: complications. You mentioned healing. What if it doesn't go smoothly? The sources say about 1 in 10 women face some kind of wound issue.
Yeah, it's a significant number, around 10%. So vigilance is key, even when you're sleep deprived and focused on the baby.
What are we watching for? Are the signs obvious?
Usually, yes. Looks at the classic signs of infection. Is the incision getting more red? Is it more swollen? Does it feel warm to the touch? Any fever, and especially any kind of foul-smelling discharge.
Got it. Redness, swelling, warmth, fever, nasty discharge. See that? Call your doctor.
But immediately, don't wait.
Right. Now let's jump ahead. The big 6-week checkup. This feels like where a lot of the confusion happens.
Oh, definitely. The 6-week misconception.
Yeah. People think, okay, doctor cleared me. I can go back to my normal workouts now, especially if you're active before. Like, time to lace up the running shoes.
And it can feel like a real letdown when you realize, nope, your body isn't ready for that yet.
So the 6-week clearance is more for, driving, gentle activity?
Exactly. Driving, longer walks, maybe some very gentle core reactivation if guided, but high-impact stuff. Running, jumping, HIIT classes, that really needs to wait. We're talking at least 12 weeks postpartum, often longer.
12 weeks minimum for high impact. Wow. And that rehabilitation piece is key, isn't it? Specifically for the core and pelvic floor.
Absolutely crucial. This is where seeing a pelvic floor physiotherapist comes in. It's not just about standard postnatal exercises.
Why the specialist, though? Why isn't a general routine enough after a C-section?
Because the surgery cuts through multiple layers, skin, fat, fascia, and it separates the abdominal muscles. That connection between your deep core muscles and your pelvic floor gets significantly disrupted.
Oh, okay.
A physio can properly assess how things are firing, teach you to engage those deep muscles correctly without compensating, and help you rebuild strength safely before you even think about adding impact or heavy loads.
Makes sense. And we also need to touch on the scar itself. That changes over time, right?
It does. It can take up to a year, even longer sometimes, for the scar to fully mature and fade.
Is there anything practical you can do? I've heard about silicone sheets.
Yes, silicone gel sheets or tape can be helpful. Usually start using them maybe 2-3 weeks after surgery, once the incision is fully closed and healed, no scabs left. They can help soften the scar and minimize its appearance over time.
Good tip. Okay, switching gears slightly. The emotional side. This often gets overlooked, doesn't it?
Hugely overlooked, but so important. Having a C-section, especially if it wasn't planned, can bring up a lot of feelings. Disappointment, maybe grief about the birth experience you expected, sometimes even trauma.
And that's all happening on top of the usual postpartum hormonal shift.
Exactly. We know postpartum depression and anxiety rates are significant anyway, maybe 15-20% of mothers overall. Major surgery and a potentially difficult birth experience can add another layer.
So acknowledging those feelings is step one.
Absolutely. If you're struggling with persistent sadness, grief, anxiety, or feeling inadequate, please reach out. Talk to your doctor, look for birth reflection services, counseling, find a support group. Your mental health matters just as much as the physical healing.
Okay, so pulling this all together for you listening, the big message seems to be patience, right? Recovery is definitely a marathon, not a sprint.
100%.
And practically. The most useful tip seems incredibly simple. Accept help. Let people cook, clean, run errands. Don't try to be a superhero.
Please don't. And maybe get some comfy, supportive, high-waisted underwear or a belly band. That little bit of support can feel really good.
Good practical advice. Okay, final thought from you.
Just to reiterate that patience piece. Everyone heals differently, on their own timeline. But maybe the most important thing is self-respect. Think about what your body just did. It grew and birthed the human. Treat it with the incredible respect and the gentle care it truly deserves after such a monumental event.